welcome to the Sex Experts webinar series given by Center for Healthy Sex. My name is Kayna Cassard, and I'm one of the clinical associates here at Center for Healthy Sex. And today we're going to be talking about coping with female pelvic pain and difficulty reaching orgasm. Okay, so to get specific, what we're talking about to start is painful penetration, and this can occur in different ways. It can be diagnosed as vaginismus, as dyspareunia, or as vulvodynia, and oftentimes they're given different diagnoses by different health practitioners. So even gynecologists have different ways of diagnosing these issues, and so we'll go over it a little bit here in order to get a sense of exactly what it is that we're talking about. So vaginismus is the tightening of or the automatic spasm of the vaginal muscles, or the muscles basically that extend from the pelvic bone in the front, the pubic bone in the front to the tailbone in the back. And if you think about those muscles as like a hammock that stretches from those areas and sort of holds up all of the internal organs. Both men and women have these muscles, but in women specifically, when those muscles automatically tense up, it's called vaginismus, and that can lead to painful experiences either in the muscles or in the skin tissue in the vaginal area. The next one that I mentioned is dyspareunia, and the technical definition of this is pain during intercourse. And this can be expanded to any sort of sexual intercourse, whether that's with using sex toys or whether that's using having penile-vaginal penetration. And then vulvodynia is another term that refers to pain in the vulvar area. And again, this can be as a result of gynecological exams, tampon insertion, and sex as well. Then anorgasmia is the inability to orgasm or its difficulty reaching orgasm. This can be specific to a situation or it can be generalized, so that and that means that a woman can't orgasm, or it could be that sometimes she doesn't orgasm. This also affects males too, but for today's talk we'll be talking about just female anorgasmia. The causes of these issues can be quite large. They could be And it could be very difficult to identify specifically what the causes are. Sometimes the cause could have happened years and years prior, and the woman didn't realize that it was a cause of it, and then suddenly she's starting to feel the effects. And so this could be, for instance, a psychological concern or trauma, or it might have been chronic yeast infections, or it could have been childbirth and then there's scar tissue left over in the vulvar area. So trying to identify the specific cause can actually be quite helpful in directing the treatment, but it's not completely necessary in order to obtain treatment for any of these issues. And the same thing goes for anorgasmia. The cause could be a little bit abstract because it might be something as simple as, or as difficult and complex as the way a woman was brought up in her childhood and the messages she received about sex or sexuality. Or it could be a worry or concern about her body image and how she carries herself sexually. And so it's important to start to address these concerns and these issues through therapy or with a trusted friend or professional to try and figure out what exactly is going on and why the woman is having difficulty with this.